Good evening, everybody. We're back for Fertility Experts Live, and tonight I'm going to be joined by Dr. Shlove from IVF Spain. We're going to talk all about implantation failure, what that means, how it can be helped, the testing involved, and all sorts of things, and want to hear all of your questions. So she's about to join any second now. Hi to people who are joining. I'm just going to see whether she's here, and then we can start. She's not here yet. So just to say, if you have any questions as we go along, please don't hesitate to ask. She will be here any second. In the meantime, I don't know if you've seen, but Dr. Shlove has written the most insightful Q&A answering our readers' questions, which is on the Fertility Help Hub website, all about implantation failure. So it tells us what the signs are, what can be done from a medical perspective in terms of testing, how you can support it with lifestyle, and all sorts of different things to inform you if you're worried that that might be you. We're just waiting for her to connect now, so bear with me. Thank you for your patience. Does anyone have any questions for her before she joins? If so, just send them over and I'll make sure to ask them. Here we go. She's here. Thanks for your patience. Just connecting now. Hi to those who are joining. We're going to be talking about implantation failure tonight. We're just waiting for the connection and then we can chat. So as I said, please fire away any questions that you've got as we chat, and Dr. Shlove will be only too happy to answer them. Sorry, I don't know what's happening, but it just says that it's waiting for the connection to work. There we go. Good evening, Dr. Shlove.
Good evening. How is everybody?
Yeah, okay, thanks. How are you? How's the situation in Spain?
Now things are going in the right direction. We have 3 months, very tough months behind us.
Mm-hmm.
But slowly we are going back to work. The hotels are being opened. Some restaurants are open. So we hope in July, August, we will be able to see our international patients.
Great, that's really reassuring to hear. And the clinic has been open during this time, is that right?
The clinic has been open the whole time. The national department has been working full time. International department, I felt, like I was on retirement because I used to work 3 hours a day only. So it has been a luxury. But we collected the energy. We are not going to have vacation this year. We're going to be there over the summer for people who need us.
Wonderful, that's great to hear. So you've just written a brilliant article for Fertility Help Hub. Thank you for that. Answering readers' questions all around implantation failure. So let's talk a bit about the questions that we were asked, and also we'll take questions from people watching tonight. So first of all, what is implantation failure, and when should a patient be concerned?
Implantation failure is defined as the transfer of 3 good quality embryos without a successful pregnancy. So, there are different opinions about the definition of a good quality embryo. Some define good quality embryos on day 3 of development. When you work in Spain with egg donation, where you see eggs of a donor, when you see day 5 embryos of a donor, you know that in order to talk about recurrent implantation failure, really, it should be defined as a failure of 3 transfers with day 5 embryos, with blastocysts that did not achieve successful pregnancy.
Okay. And is it age related? Is there a higher chance of having an issue with implantation if you're older?
It's a very good question. I believe that we doctors who do not have an access to day 5 embryo culture and genetical testing, actually we generate this problem ourselves. when I came to Spain about 10 years ago, I was given the opportunity to test embryos genetically of patients in different age groups. And then amazing study has been published in 2012, Professor Atta, where it was shown that when somebody is 20 years old, 80% of embryos which are generated are healthy or genetically normal, without a Down-Edwards Patau syndrome. These were the most common abnormalities. When we are 35 years old, 50% of embryos which we generate are healthy. At the age of 40 years old, only 20% of embryos are good. At the age of 43, only 10% of embryos are good.
Wow.
So majority of cycles in Spain are undergoing genetical testing in order to avoid recurrent implantation failure.
Yeah, yeah. Gosh, it's amazing how quickly it can decline, isn't it? I always say that it would be better if there was more education at schools around the decline in fertility, so that people know about it from an earlier age and can perhaps family plan, knowing that information. So what about, sorry, what were you about to say?
You know, it's a very good point. I am probably a little bit older than you, and I remember Germany before the reunion, in the 70s, in the 80s, where we didn't have guidelines, where my generation or generation of my parents, of my mom, she used to be a gynecologist too, we were fighting for doing regular smear tests. Yeah, it wasn't an obvious to do a smear test every 3 years or every 5 years. Women were doing smear tests when something was wrong.
Yeah.
We understood that we need to do smear tests regularly. So this is the obligation that my generation, you know, has fulfilled to women in the 70s, in the 80s. I believe that the obligation of your generation is to teach young women that we should have children early, before we are 35 years old, because this is the best moment when we have the best eggs. But, you know, girls want to be independent. They want to study. They want to have their houses, cars, credit cards. And this is the moment of the best fertility when we are at school. So we should teach girls that they should do social freezing. This is the best investment which we can do.
Absolutely. We've had a couple of people who are totally agreeing. I think someone, Baby Bell, just said that 100%, if I wish I had known this earlier, I would have started. Now I'm 40. Just whilst we pause there, I just want to read back a couple of questions we've had, if you could please answer. One of the people viewing tonight has said, my embryo failed to implant despite the fact that it was PGS tested. So what are your thoughts around the success of embryos after they have been through that rigorous testing?
You know what? The reason why we started doing PGS testing was an egg donation couple from Berlin that came to us a couple of years ago, and we transferred them embryos of a young donor, genetically untested, and the lady ended up having a miscarriage. And at that time, we were still, you know, transferring 2 embryos. And the genetical study out of the material that she miscarried showed up that one embryo is genetically normal, it's a healthy girl, and the other one has a trisomy 13. So it's a Patau syndrome. And it was the moment where, even in egg donation, we started doing, in selected cases, genetical testing because we realized that nobody is perfect. There is no donor that has 100% euploidy rate. We were the first clinic in Spain who did it. And I have seen a lot of PGS cycles, PGDA cycles now in the last 10 years. And I can tell you one thing. If genetically normal embryo does not implant, this embryo has a 70% chance to generate a positive pregnancy test. You have to look deeper into your body, what is rejecting in your body this genetically normal embryo. So we do not wait for recurrent implantation failure. We do not wait for 3 transfers of euploid embryos and negative result. We look after the first transfer right away, deeper into you, and then we perform uterus lining biopsies. We see that maybe in your body, the implantation window, the moment where endometrium should be open to accept genetically normal embryo, is not there. Usually, you should take 5 days progesterone to open implantation window. But there are some ladies in our office, in my career, that need 6-7 days progesterone to open implantation window. So do not give up. There are genetically normal embryos that do not implant. Sometimes they are metabolically too weak to implant, and sometimes there is something in your body, the implantation window that is closed, or your immunology sees embryo as a foreign body, and this needs to be verified by the uterus lining biopsy. If Absolutely. You would like us to help you with this, get in touch with the clinic, and then we will be able to design a cycle. We have colleagues in London that work with us. You don't have to fly to Spain in this moment. This can be done, in London. The tissue will be sent to us, and then we will evaluate your case individually.
That's great to know. Thank you. So if anyone does want to reach Dr. Shlove, you can do it directly, or you can send me a message. Also, the contact details are in this article, which Dr. Shlove has just written, all about implantation, which is on our website. The link is in the bio. You also wrote an article for us a couple of months ago. It was actually just around the beginnings of COVID disrupting the world, all around immunology. So obviously we've just touched on that. So if anyone wants to read that, it's also very insightful. We have another question, or another person saying that their embryo felt because their endometrium was out of sync and the transfer should have been done a day earlier. She was repeating the biopsy next week, Friday. So is that a common thing, to repeat a biopsy?
Okay, so when we see that the biopsy is not receptive, where we see that we transferred outside of implantation window, the biopsy result tells you to do a confirmatory biopsy, right. Adding 1 or 2 days of progesterone to see exactly where your personalized implantation window is. And then statistically, after 2 biopsies, 90% of patients know where their implantation window is. So usually what happens is you do the first biopsy, it says after 5 days progesterone is pre-receptive. Pre means you need to add 1 day more progesterone, and then you do confirmatory biopsy with 6 days progesterone. 90% people should be in this 6 days implantation window, but trust me, I've seen in my career people with 7 or 8 days receptivity. 8 days in 10 years of working in Spain, I've seen 3 times in my life. I know by heart where they live, what are their names and telephone numbers, okay? So don't give up, do systematically work confirmatory biopsy. If you can confirm 6 days, amazing. If not, if it still says pre-receptive, then you need to do 1 biopsy more to be sure where you are, to transfer to the special endometrium that has a special demand of longer intake of progesterone.
Okay, that's great advice. Thank you. I hope that's answered the question. Another question, 4 failed transfers, all with top grade embryos. What would you suggest for next steps?
Okay, when you tell me top grade embryos, the question is, how old are you, madam? Were they genetically verified or not? Okay. You know, from my personal story, I cannot tell you my patient stories, okay? My personal story, I came here 10 years ago, young girl, 35 years old, and I had to do social freezing, okay? Yeah, at the age of 35, every other embryo that I generated was genetically normal.
Okay.
A couple of weeks ago, we received a new protocol in IVF Spain to test. Nobody wanted to test this protocol, nobody. So me and Dr. Rogel, we are good friends. We said, okay, we're going to test it on each other. So Dr. Rogel is a man, so he can do a cycle, and I have to put injections. I have to be a patient.
Oh, wow.
So 10 years later, I do an IVF cycle, a lot of eggs, but everything is genetically abnormal.
Really? Gosh.
So the solution is sometimes you generate a lot of eggs and embryos. Everything looks pretty, everything looks amazing, okay? But unless you cannot confirm if it's genetically normal or not, you do not know if it's a top quality embryo, okay? So you have to, whenever you say I have good quality embryos, you have to tell me your age, and then I know statistically how many of embryos that you generated could be potentially genetically normal. If you are 35, every other one is healthy. If you are 40, 200%. If you are 43, less than 10, okay? So first genetics, then if I transfer genetically normal embryo and they do not implant, then I focus on implantation window, and then I focus on your immunology.
Okay, that's really good advice. Thank you. I actually personally found when I did my first round of IVF, which didn't work, I was 30 or 31 at the time. And then the following round, frozen transfer with donor sperm, worked. For going back to do a new cycle for fresh embryos for a sibling, we had twins, and I actually had a better amount of blastocysts from that cycle, even though I was a bit older. I was a couple of years older, and I think that that is down to, of course, probably a tweaked protocol, but also the lifestyle I was leading and the time that I had prepared my body for this new cycle, which I didn't have time for the first time. And you mentioned lifestyle in your article, don't you? So what are your thoughts around what people shouldn't do? I mean, a lot of it's obvious, but what people could potentially be doing during this time to best prepare their bodies for implantation?
So like school medicine, it's clear, that we need a genetically normal embryo and good endometrium receptive to make it happen. I have seen, men working a lot, on the day of first appointment, confessing that they drink 2 bottles of wine a day, that they drink a lot, and they smoke a lot. So whenever one man tells you I smoke 2, you have to say like 2 what, okay? If it's 2 smokes or it's two packages a day. And I have seen me recommending these patients a healthy lifestyle. They were like leaving my office and shutting down the door. And I was thinking that this guy is never going to come back. And after 3 months of healthy lifestyle, from concentration lower than 1 million, people were able to have a concentration 2 million. Okay, so I have seen in 10 years only working in egg donation in IVF PGS cycles in Spain, I've seen really impact on healthy lifestyle on the sperm quality. I always say to men, listen, you want to improve your DNA fragmentation. I'm prescribing you antioxidants. You have to be on vitamin C, you have to be on vitamin E, high dose, high ejaculation frequency. This is something that they like me for, means sex twice a week. And then I say the bad news for you is if you really stick into my protocol, you should avoid smoking. Yeah, because I give you antioxidants, vitamins, you pay for it, and then when you smoke, you just oxidate your own DNA in your sperm cells. So there are things that men can do to improve sperm quality. When we talk about male factor, women, of course, when you have somebody in the treatment of rheumatology with methotrexate, with prednisone, this is not the best moment to do a cycle. Yeah, you have to be physically in a good shape for us to make it happen. Sometimes people take medication from dermatologists for better skin, anti-vitamin A medication. You have to be off this for 6 months so we can do a cycle. And women, there's nothing much more which we can do.
What about foods? Do you feel like nutrition plays a role in preparing the womb lining?
Nutrition doesn't have much impact, I would say, on the eggs quality, but there are some natural estrogens in soya, in different kind of beans, which can improve, natural estrogens can improve the uterus lining thickness, but it doesn't have an impact on receptivity. Receptivity has to be verified by the biopsy.
Okay. Someone's asked, what dosage of vitamin E and vitamin C do you suggest?
A lot. Vitamin C is 1 gram a day, 1,000 milligram, and vitamin E is 800 milligram a day.
That's really good to know. Thank you. I hope that's answered their question. Someone's also asked, in which day is good to do the biopsy? I'm not sure if you've mentioned that yet.
It's a very good question. As you can probably hear, I have a strong American background. So in the United States, we do not transfer anything in natural cycles anymore. I will say that I will sign it. Professor Shapiro from Fertility Center of Las Vegas was always teaching us that with frozen cycles, we have higher success rates as with fresh ones. So basically, with artificial hormones, we mimic your natural cycle. We give you 15 days estrogens, 5.5 days of progesterone, and day 21 of your artificial substitute cycle. This is the moment where we do the uterus lining biopsy. So, it's quite hard to adjust the day of a biopsy to your schedule, work. What we do usually is, when we have a first consultation with a patient, you tell us your availability, and we make for you a personalized medication plan that through artificial hormones, we can adjust it to your schedule and our schedule. As I say, I know, for people in UK, which reproductive medicine is not quite there, as in US now, you guys still believe in natural cycle, natural IVFs, in America and now in Spain, in IVF Spain, we do majority of transfers in artificial cycles, and the biopsies are also done in artificial cycles.
Okay. Is that the case even if someone's got a regular cycle?
It is.
Is that just because you have more control over it?
You know what? This is one thing. The other thing is, we were trying here in IVF Spain to show that natural cycles are better. And then what happens is, usually women ovulate from follicles, which are 16, 18 millimeters. But some women start producing progesterone when the follicles are 12 millimeters. So the progesterone, the moment where they start progesterone is too early. It's not 5 days progesterone. You start having like progesterone 7, 8, 9 days. No matter what you're gonna do, if you have 9 days progesterone and you put in natural cycle, and you put from the follicle 12 millimeters, and you put on top of this blastocyst, which is 5 days old, you will never achieve the pregnancy. So that's why statistically the better results we have when we have everything under full control.
Okay, that's really interesting to hear. Thank you for that. And in terms of testing for implantation failure, are there lots of different kinds of tests, or is it kind of the same test for everyone, and is it expensive to do?
Okay, in order to avoid implantation failure, in order to be implantation failure free clinic, you need 3 things to tango. First, genetically normal embryos. So you need to have a lab, and you need to have a team of embryologists who know how to biopsy, who do not harm the embryos. You need to have endometrium, which has open implantation window, and you need to have endometrium verified by the biopsy for natural killer cells. And if there are any immunological abnormalities, you have to be able to correct them. You have to understand that there are immunological protocols that are not good for everybody. For certain pathology that we see in uterus lining, we administer this kind of medication. So these 3 things need to be taken into consideration for implantation failure.
Okay.
What is important in IVF Spain, we work. We do not wait long time for results. And when we see that somebody has done a cycle with us and embryos are genetically abnormal, it's a very sad day for everybody.
Of course.
But then a doctor who you have been working with gives you a phone call or FaceTime or whatever, gets in touch with you, and you're getting reevaluated. If you do one cycle again, your age factor plays your age, AMH, are playing a very big role if we go for one cycle more, or you are switched to egg donation. Especially when you are over 43 years old, then the doctors explains you what egg donation is all about, which steps you need to undertake, that we find you a suitable donor here in Spain. And this is how, IVF Spain is recurrent implantation failure free clinic, because we take decisions quickly. We do not allow anybody to do 3-4 cycles with own eggs and have 1 year of negative results. Because psychologically it's too demanding for everybody. This is the moment, after 1-2 cycles, no genetically normal embryos, egg donation.
I remember having exactly those feeling if this one doesn't work, I don't know how I'm going to get through this after the last fail. And I was reading someone's post today who said that, and I'm sure lots of people who are reading this have been there and are nervous and apprehensive about those feelings. So it's, as you know, a very, very difficult time. But thank you so much for answering all of these questions. It's been very insightful. Please, everyone watching, go to Fertility Help Hub website and read Dr. Shlove's article, which you'll find on the homepage. That features everything we've discussed tonight about implantation failure, and also you can find their article from a couple of months ago on immunology. And Dr. Shlove, if people want to get in touch with you, are you doing any open days or any virtual open evenings that people should know about?
Okay, you can imagine that last year I had 20 international flights, and we were in London once a month.
Mm-hmm.
So I hope when the COVID is over, we're going to go back to normality, and we will be seeing patients live in the heart of London.
Right.
I don't know when. So in the meantime, we organize patient meetings online. Our marketing department is working on it. So I'll be more than happy to, if you have any personal questions or doubts, contact IVF Spain, and then we will schedule. We do free Skypes now. We do not charge for consultations.
Yeah, that's brilliant. That's brilliant. And actually, people can book directly if they go to this article, which they should read all about the topic we've been discussing tonight. You can book directly to be part of those conversations and have those free consultations with you. So that's really good to know. Thank you so much.
Welcome.
Thank you everyone for watching tonight. And yeah, any questions, send them over afterwards.
Have a good night.
Lovely to speak to you. Thank you. Thanks, Dr.
Well done.
Shlove.
Great job. Bye, guys. All the
Bye-bye.
best.
Bye-bye.